everyone, and welcome to the Unit 1 video. So this is the Unit 1 and 2 video. So there's going to be quite a bit of information in this video as well as in the following weeks, just because you are going to be completing so much material each week. So let's go ahead in the syllabus. Let's go down to the tracking calendar where it talks about Unit 1 and Unit 2. So I'll go through in order. So for Unit 1, you're going to read Chapter 2 in your book. You're going to review the ACA Code of Ethics, which is provided in the unit video or the unit material as an attachment. You are going to read 2 supplemental articles there as well. Watch the Brene Brown, The Power of Vulnerability TED Talk. Submit the Unit 1 assignment. Remember, 200 to 250 words per question. Journal reflection number 1 and quiz number 1. So first thing that pops out for me that I want to make sure that I mention is the supplemental research articles. What I want you to do is not focus so much on the actual results part or the procedure part. What I want you to focus on in these articles where applicable is the introduction, where it talks about what exactly the study is trying to accomplish, and then discussion where it actually breaks down and talks about your results or the results of the study in terms that everyone can really understand. So don't feel like you have to go through different pieces of some of these articles where you're kind of reading through the results and the procedure and you're like, I have no idea what's happening, because I don't expect you to really be fluent in that as an undergrad student. So some of the other articles are just like very informative, period. So you want to make sure you read through all of those. But for the articles that you're doing that there's actual, or you're reading that there's actual research done, those are my expectations. So just keep that in mind. Okay, so for Unit 1, it's pretty simple. You're going to learn about the counseling profession. So the professional orientation, the code of ethics, and connecting with the profession. As well as the code of ethics, don't feel like you have to go and read through this verbatim again. This is just something I want you to review. So the code of ethics is something that us as counselors or counseling professionals have to abide by to ensure like the safety and well-being of not only our clients but ourselves. So those are basically like the expectations of functioning as a counselor under the ACA. So Unit 1 is pretty straightforward. So if we are looking at the journal reflection number 1, so the prompt for journal number 1 is the APA requires some accredited programs to incorporate cultural competency training into their curriculum. In what formats do you think such training would be most effective or beneficial? So for example, do you think that it would be best, provided and translated by students as like a multicultural course, interactions with clients from various cultural backgrounds, shadowing? What do you think the best method for teaching cultural competency would look like? So what format do you think you would personally prefer as well? So what do you think would be the most beneficial and what would you prefer? Sometimes those are 2 separate things. If they're the same thing, that's fine. But think about that a little bit. So then we are going to take a look at quiz number 1. So I am just opening this so that we can go through and see which question I noticed that students typically struggled with in the past. So let's see. Okay. So let's take a look at this question. So when considering diagnosis, it is required for counselors to consider the client's blank blank, as this affects the manner in which the client's problems are defined and experienced. So this is in your reading material, but I have noticed like an array of responses from students over time. The correct answer here is cultural experiences. So due to different cultural norms, expectations. Things might be experienced a little bit differently. Mental health might be presented in different ways or not presented in different ways. So if a counseling professional is making a diagnosis, we always want to make sure that we are considering their cultural experiences or their cultural background. So the other one I'm going to give you is the question of a professional counselor is considered to be a clinician with a master's degree or higher. The answer to this is true. So you can be a counselor with an undergraduate degree, but to be a professional counselor, such as maybe working towards licensure or something, you have to have a master's degree. So that is why that one is true. So those are the two questions that I will give you for quiz number 1. So as I said, Unit 1 is just really the basics, what's involved in counseling. We are not there to befriend our patients. We're there to listen and, just kind of be there as a support for them. And we'll get a little bit more into that in Unit 2. So these 2 units actually pair up real nice. So when we talk about Unit 2, the topic here is what happens in counseling. So this is where we're going to get into our first counseling profession. So we're going to talk about clinical mental health counselors as well as addiction counselors. I'm actually very familiar with these counseling professions as I serve as both of these in my full-time day job. So I know that I mentioned to you in the welcome video that I'd give you a little bit of insight into my personal history as a professional counselor. So just to kind of keep it short and sweet, I received my bachelor's, my master's, and my PhD, all from UV. I am a licensed mental health counselor as well as a certified rehabilitation counselor. And although it's not necessary, I am applying for my CASAC, which is a certified alcohol and substance abuse counselor. So let me go through kind of what's involved here in just a second, but I do hold 3 positions personally. So during the day, I do work for a nonprofit clinic providing therapy. I teach part-time here at UB, and I've been here for a number of years. And I also run my own private therapy practice part-time as well. So just with my experience alone, I've held a number of jobs in the counseling field. So I'm pretty well-rounded and understand a lot of what counseling professionals in a number of these positions that we're going to talk about require and what the credentialing process is for them. So for Unit 2, you're going to read chapters 3 and 6 in your textbook. So that will be the chapters of the clinical mental health counselors and addiction counselors. You're going to watch the video of what happens in counseling. You're going to read a supplemental article, submit the Unit 2 assignment, complete discussion board number 2, and then complete journal reflection number 2. So for discussion board number 2, you are going to, let me just see something here. Okay, you are going to watch a TED Talk that is included in the discussion board. There's a link when you go into the actual discussion board. And what it talks about is trauma-informed care. So the discussion board number 2 prompts, again, are in the tracking calendar as well as in the actual discussion board post. And one thing that I want to warn you of is when you're responding to the discussion board or in your assignment, trauma-informed care is not an intervention in counseling. It's more of an approach. So Dr. Kelly will talk about this. But trauma-informed care is essentially approaching every person in your life or that you're working with the assumption that they have experienced something traumatic in their life. So that makes us more sensitive to people, what their experiences might have been, and just really prevents us from re-triggering anyone or, having some type of adverse kind of impression on them. So make sure that that's kind of how you're internalizing this as you're going through the material. So for the journal reflection number 2, let's go back here. So This is where we're going to start looking at the advocacy paper stuff. So as we're considering the topic for our advocacy paper, let's be sure that we know what is meant by advocacy. So what is advocacy? What does it look like? So tell me, when you hear the term advocacy, what comes to mind and how can you advocate for others? So this is me just making sure that you actually know what advocacy is so that you can write an appropriate advocacy plan to advocate for a vulnerable population. So in this journal prompt, we're just checking in. You know, what comes to mind when you hear advocacy? What is advocacy and how can you advocate for other people? Feel free to look it up if you need to. If you're not entirely sure, that's totally okay too. I just want to make sure that everyone has a good understanding of it. So that's it as far as material goes. So with clinical mental health counselors and addiction counselors, this can be a little tricky because clinical mental health counselors have to have a license in New York State. Addiction counselors only have to have a certification. So like I mentioned in the welcome video, there's a number of counseling professions that only require a nationwide certificate, such as like a rehabilitation counselor. But in the US, in order to be able to bill insurances for services, you have to be licensed as a therapist. So clinical mental health counselors have to be licensed. And that license, there's 2 different exams and 2 licensures that are recognized throughout the country. So some states recognize one, some states recognize the other. So I think the example that's in your book, her credential or their credentials in LPC. So that's a licensed practical counselor or professional counselor. And that is what the other states consider to be the equivalent of an LMHC. So just in case you get confused with that. An addiction counselor. So New York State has a certification for addiction counselors called the CASAC. So Certified Alcohol and Substance Abuse Counselor. What's tricky here is individuals who are licensed mental health counselors who have a scope in addictions can serve also as an addictions counselor without that certification. So, for example, the clinic I work in, we actually serve those struggling with substance use as well as mental health issues. So me, as an LMHC, I can provide services to both. I also am a CRC, though, which would offer me the ability to practice in addiction counseling. But someone with an LMHC can practice both mental health counseling and substance abuse counseling if they have a scope in substance abuse counseling. However, someone with a CASAC, someone who's a certified alcohol and substance abuse counselor, cannot provide mental health services. So as you can see, having this license gives you a lot more leeway and a lot more options as far as what you can do with your career. And I hope that makes sense. So please let me know if that was confusing or if you intend to become either one of these professions and you want a little bit more information or me to clear things up a little bit more. That's totally okay. We can talk a little bit about that. So just a reminder, everything for this unit is due Sunday, the 8th at 11:59 p.m. The other thing that I want to note is for the introduction unit, if you didn't get to this before the class started, that's totally okay. I cannot expect people to start the material before the actual semester starts. But yeah, if you can go back and do discussion board number 1 where you're just introducing yourself and whatnot, please feel free to go ahead and do that. That is graded. But as of right now, it's not considered late. It'll be considered late after the 8th. So you are now responsible for the introduction unit, unit 1, and unit 2. Let me know what you need. Keep in mind 200 to 250 words, and make sure you are doing your initial post on the discussion board as well as commenting on 2 of your classmates' posts. And I think that's it. So if you have any other questions, let me know, and your next unit video will be posted Monday. All right, have fun.